Hello, my name is Jatin Patel and I'm the Principal Dentist at Egham Dental Care. Today I'm going to be talking about tooth whitening, and we've been having a lot of inquiries recently about how it works, how old you have to be, how well it works, etc. So I'm going to take the opportunity today to explain give the answers to some of the common questions, and towards the end of the video I'm going to show you what the procedure is in the surgery and what you need to do at home as well. The most common questions are: how long does it take? The tray-based whitening that we recommend typically takes about 8 days, and that you do at home. It's the tray-based system. Another question that exists is, does it hurt? No, not really. During the procedure you can get a little bit of slight sensitivity, but it's nothing more than just a little bit of cold water, and the sensitivity dies away once the whitening procedure is finished. Another common question is, does the tooth whitening actually damage the teeth? Not at all. It's a completely safe and ethical treatment, and in fact in dentistry it's one of the few things that has virtually no side effects. So there's two types of tooth whitening that we offer at Egham Dental Care. One is the in-surgery laser whitening, which is by the system Zoom, which is made by Philips. The other system is the tray-based whitening, which is done at home. In our honest opinion, while the Zoom system has its benefits, mainly speed, we prefer to do the tray-based system purely because for absolute outright whitening results it seems to have the edge. In addition, the laser whitening is £399, whereas the home tray-based system is £199, so it also has the cost advantage as well. With the tray-based system, it involves taking some impressions, sending them off to the laboratory, and then we return the trays back to you. We show you full instructions on how it works. Typically you wear it for about 2 hours in the evening after you've had your dinner and you're watching television, and over the period of 8 days you'll get a significant improvement in the tooth colour. Another common question is, how white will my teeth get? That's a very important question. If you've had tooth whitening done in the past, or if your teeth are naturally white, then there will be a slight reduction in the amount of whitening that you can achieve. Conversely, if your teeth are a really yellow shade, there's more of a tooth whitening effect to be had. And that's purely because the whitening can only go so far. So if your teeth are already towards that shade, then you're going to see a smaller result. And that can happen, as I said, because either your teeth are naturally white or if you've done tooth whitening in the past. Some of the benefits of the tray-based whitening system are that because you're whitening the teeth at home, actual technology allows you to put gel in individual tooth compartments. What this means is that you can whiten individual teeth by varying amounts. What we found is that people's teeth can differ in colour, such as the canines, which are the fang teeth, can be significantly darker than some of the front ones, and tray-based whitening allows you to whiten those more than others if necessary. Common issue with all types of whitening, whether it be the tray-based one or the laser one, is that whitening will not whiten anything artificial. It can only whiten your natural tooth enamel. So if you have a lot of fillings or crowns in the aesthetic region at the front, either don't do whitening or be prepared to change those fillings to the new shade which the whitening achieves. Also, during the whitening, it's wise to avoid any strongly coloured foods and drinks such as tea, coffee, red wine, soy sauce, and curries with the turmeric in it can be a bit strong. So we tend to advise patients to avoid that for the 8-9 days that the whitening happened over. After the whitening is finished, you can carry on with your normal food and drink regime. At the commencement of whitening, we typically take photographs which are calibrated on a high quality camera against a shade scale. And what that means is that we have an exact record of where your teeth started, and then we can compare that shade against the end scale. What we don't recommend is, when you're doing the home whitening trays, to look in the mirror every single evening. What you'll find is that your eyes will acclimatise to the improvement and the actual shade may not be immediately apparent. It's best to wait, do all 8 days, and then return back to the surgery so we can compare it against the original shade. Another typical question that's asked is, what happens if I misplace or lose or damage my trays? That's not a major issue. We're quite happy to make another set for you, although there is obviously a small laboratory charge for that. Due to the nature of the tooth whitening treatment, it makes for an excellent present because it's a completely self-encapsulated treatment. Typically, gifts, pre-wedding treatments, these are all perfect ways of doing it either for yourself or as a gift to someone else. For couples getting married, etc., it's quite a common scenario that they want to do whitening together, and we're perfectly happy to offer couples packages for the tooth whitening, so please do call us and we'll explain things over the telephone. Now watch the video for the exact procedure in the surgery and you'll get a really good idea about what to do when you come to the practice. Upper and lower impressions are taken and allowed to set for 30 seconds. The impressions are then taken out and sent off to the laboratory for the construction of the tooth whitening trays. This typically takes 3 days. The tooth whitening trays are made of a soft rubber material. The trays are tried into the mouth for correct fit. They are typically very comfortable to wear. High-resolution photos are taken to show the starting shade. Upper and lower tooth whitening trays, as well as 4 syringes pre-filled with the whitening gel, are supplied as part of the kit. Additional tooth whitening syringes can be bought at any time from our practice. A small 2 mm wide drop of the gel should be applied into each of the tooth compartments, as shown in the video. We provide 6% hydrogen peroxide day whitening gel, which is the equivalent of 19% carbamide peroxide night whitening gel. Here you can see the 2 mm wide drops in each of the tooth compartments. The tray is then inserted into the mouth, being careful not to squeeze the trays sideways, as this could make the gel ooze out over the gums. After 2 hours, the tray is removed from the mouth. The trays are washed under cold running water using a toothbrush if necessary. After 8 days, end photos are taken for comparison purposes. Here you can see the complete contents of the tooth whitening kit that we provide for you.